Oh, all that energy. Let's go to the state of North Carolina and the 5-star rated license with Carmen Hooker Odom, who is the Secretary of the Department, and Peggy Ball.
Thank you very much for the opportunity to tell you about our 5-star rating for quality child care that is now operational in over 9,000 child care centers and facilities and affecting more than 230,000 children in North Carolina. When the star rating system became mandatory in the year 2000, only about 19% of the child care centers and homes had ratings between 3 and 5 stars. Today, that number is over 60%. This means that over 70% of the children in regulated care are now enrolled in programs with ratings of 3 to 5 stars. An investment in quality child care has a wonderful effect of improving children's success in school, but an investment in quality child care is also an economic development investment. Art Rolnick, who is with the Minneapolis Reserve Bank, says that the wisest choice a state can make in economic development and return on investment is in an early childhood education and care, even more than tax incentives. We must realize that quality does matter. No matter what your socioeconomic status is, you want the best for your child. Our 5-star rating system gives parents peace of mind, a sense of security, and for those children who are at risk, and for those children with special needs, it gives them hope. In our quest to move from having some of the poorest quality child care in the country to now being a leader, we abandoned the traditional approach to licensing used by other states. Their regulatory agents set a floor for minimum health and safety standards and rely on external accreditation or some single measure to recognize higher quality. We created a unique licensing system that maintained a floor for health and safety standards, but also included higher incremental licensing levels in all the areas that research tells us produces better outcomes for children. Last week, I toured a place called Hope Haven, a residential treatment and training center for homeless substance abusers. Young children of homeless substance abusers would certainly be considered to be some of our children most at risk. Their child care center just received a 5-star rating, and that gives their children a big jump on a better life. That's the kind of success story we see repeated across the state of North Carolina, and that's why our star rating system is crucial to our childhood development and our economic security efforts.
We tested our star rating to assure that it accurately measures differences in quality. We also assess groups of children in star centers. No matter what gender, ethnicity, or income level, children in our higher star centers did better on measures of cognitive, language, and social skills. We've conducted a study that shows that children with disabilities have more access to inclusive settings under our system, and we have fewer reports and substantiations of abuse and neglect in our higher star centers. Parents use the star system in making their choices when they put their children on waiting lists. Almost 80% of their children that are on waiting lists are on the list for the 3 to 5 star centers. Parents are very aware of what the stars mean for their children, and we make sure they can get the information they need. They use our website, which provides detailed information on all child care centers and homes in English and Spanish, or they call our 1-800 number and we send information. All child care resource and referral agencies, county partnerships for children, county departments of social services, and many job link centers use the information on our website and in our files to help the parents. Many states and organizations contact us regularly for information on our system. We've been invited to the Yale Child Study Center, Cornell University, South Carolina, and Nebraska to consult with them on developing their own model. Others visit us. Tennessee designed their star system based on ours, and Arizona's governor said in her State of the Union address that she wanted a system like ours. Finally, the rated license system helps us pull the pieces of early childhood system together in North Carolina. All child care programs in North Carolina have star ratings. including Head Start, developmental day centers, more for pre-kindergarten programs, and public school preschools. The star ratings have given us a common core standard that we lacked, a consistent measure of quality across all early childhood settings.
Thank you. Maria and then Lee.
Two quick questions. One, how long did it take you to get agreement among the various stakeholders as to what the appropriate standards should be for the 5 stars? And two, what is the cost of actually developing, implementing, and maintaining the star ratings up to date so that, in fact, you have timely information?
Well, we actually passed the legislation, and that said we would design such a system. And then it took us about 6 to 9 months to bring together stakeholders in a design of a system. We had a very intensive program of public communication, forums around the state, lots of providers, parents, advocates, other agencies involved in the development, and experts on that. The cost, when lots of states ask us this, and we even get candidates for office who call us frequently and want to know about our system. One of the things that we did is we automated a portion. We knew this system was going to be much more complex to administer, so we automated it. Portions of it, we centralized portions of it to cut down on the cost. We looked at the whole thing and put out those pieces. We outsourced a piece of it, not only because of the cost, but also because, I don't know that it's necessarily less expensive for us to outsource it, but it gives more objectivity to that piece. And then the last piece was what our licensing consultants did. So that made it possible for us to do it within our current workforce.
David, no, Lee.
I'm wondering to what extent the acceptability of the system depends on it having been developed within the state, and to what extent you think other states, if they are going to build on it, are going to have to do major adaptations or minor modifications?
We counsel other states frequently, and we tell them, here are our 3 components that we look at in our license: program standards, education of staff, and program compliance. And you can earn points in each area, and then the combination of your point makes your stars. We tell them, you need to look at where your areas of deficits are, your greatest concerns, and design your components. We can help you do that because we know the research, but you must tailor it to fit what are your particular needs and what are your resources to support it.
So you wouldn't recommend exporting it wholesale to other states?
No, I don't think anyone would. Tennessee, who has done it, does it very like us, but they use 3 levels. They use the component that we have outsourced, but they're bringing that back internally with it. So I think you have to do adaptation, and we've talked to people frequently when they call. We counsel them through that process.
Yeah, can I ask you this? Is this part of Smart Start?
No, it's not. This is
a separate program?
This is a separate program. We are the regulatory. This is a regulatory system, and this regulatory system could apply to other kinds of regulation, like nursing homes, all kinds of regulation. So no, we're the regulatory agency. Smart Start's the Early Childhood Initiative. They actually use data coming out of our system to measure what are the needs that they have in their county.
I still don't understand. The reason I'm asking is we've given an award to Smart Start.
Sure.
And I'm trying to figure out
whether
in effect this would be viewed as a second award to Smart Start.
No, it wouldn't, because that's a public-private partnership. They don't have anything to do with the regulation. The only thing they have to do with it is they use the data from what we have found in our regulation to actually determine what the needs are in their county. We're the regulatory agency. They're the public-private partnership that develops the local partnerships for children down at the county level.
For daycare or for preschool?
For all of preschool children and all of their needs. They look at more than just childcare. They look at health needs, family support, all of those factors that we don't have anything to do with.
Susan and David.
I'm from California, and every time we talk about childcare licensing, everyone says, well, we only have the funds to inspect once every 3 years. How do you manage on a funding basis to rank, because that would take considerably more staff and certainly more frequency. So how much extra cost would you need per, for example, I don't know if you do it per client or per child care center, as opposed to the normal just licensing once every 3 years or so?
Well, that's the management process I talked about. We looked at the whole system. What did it take to do this? And you could have just, somebody could say, okay, we're just going to increase the number of staff, we'll roll it out, we'll visit them more often. We said, no, there's not enough money to do that. So let's look at what you have to do. What are the pieces in here that we could automate, such as the program compliance? What are the pieces that we could centralize the work so we could use fewer staff, and we actually took staff and redefined their functions and had them do that.
So you didn't increase staff to do this?
No, we didn't increase staff because of this. We did at the same time, the law passed said that we had to also license homes. And so we did increase staff to handle homes, but we did not increase staff to do the licensing process, which we had been doing for centers. We do spend about $2.6 million on the outsource contract, which is the assessments, the environment rating scale assessments. But we use federal block grant funds for that, which all states have.
So your time is basically up. David, did you have a question that's pressing you'd like to?
Yeah, I just wanted to ask about your definition of quality. You know, Deming says that quality is in the eye of the customer, and you chose not to include any customer rating, any parent's rating of the quality of centers. And you focus on program standards, staff education, and compliance history. We all know teachers with lots of degrees who follow the rules who aren't necessarily good teachers, so those things don't guarantee quality. And you said earlier you've done a study that proves that these three factors really do produce quality. Can you tell us how you've proved that?
Briefly.
We had an outside evaluator come in and look at facilities with our ratings and then use a different assessment tool to apply to those centers to see if you get the same results on the ratings, and that was the way we proved that. We do use parents' input on that. We had lots of parent focus groups, and we get a lot of input, and parents tell us all the time, and they, you know, where they put their children on